Thanks.
Hello, hi, good evening. Welcome to AccuCheck Wealthy. We are back again with a new topic, new speaker. As promised, 2023 is going to be a year of information, knowledge sharing, and ensuring that you yourself can work on your disease condition. Hello, Mr. Chakravarti. Good evening. Thank you for joining today's session. Hello, Sharma ji. Good evening. Hello, Nayan. How are you? Hello, Virendra Singh ji. कैसे हैं आप? Hello, Mr. Terkhedkar. Happy to have you back. Hello, Mr. Patra. Thank you for joining. Hello, Sanjeev ji. Good evening. Hello, Mr. Ajay Kumar. Thank you for joining today's session. Shambhulal ji. तबीयत कैसी है आपकी? आई होप आपका ब्लड शुगर अभी कंट्रोल में है. हेलो प्रमोद जी, गुड इवनिंग. हेलो मिस्टर अशोक, हाउ आर यू? हेलो मिस्टर राव, आई होप यू आर टेकिंग केयर ऑफ योर हेल्थ. हेलो केतुल कुमार जी, गुड इवनिंग. थैंक यू फॉर जॉइनिंग टुडेज सेशन. All right, let's wait for our AccuCheck Wealthy family. Lot of users are planning to join today's session. Today's topic is quite interesting. We have a very good speaker with us today, an expert by profession. We'll shortly introduce her. Uh, let's wait for more of our AccuCheck Wealthy members and then we'll start with today's session. Meanwhile, a warm welcome to all of you. Thank you so much for sharing the topic, the speaker, and the details, Mr. Chakravarti. We are glad to have you as a part of our webinars week on week. All right. Without any more delay, let's start with today's discussion. Our speaker for this evening is Meenal Kataria ji, our senior nutritionist, our content therapy creation team member, somebody who has a personal experience of handling more than 1,000 patients with all kind of disease conditions, an expert opinion creator for AccuCheck Wealthy program. Just to give you an example, the videos, audios, information, magazine articles, what you read in the app are also contributed by Meenal as a part of the clinical support we have at AccuCheck Wealthy team. Welcome, Meenal. We are glad to have you as a part of our webinar today. If you would like to introduce yourself before we start with today's topic.
First of all, I would like to thank you for giving this warm opportunity for me to have a nice conversation with the people and teach them or guide them through their journey while dealing with the diabetes. So yes, I've got a 14 years of experience in the diabetes management and nutrition in terms of clinical nutrition practicing since that.
Great.
So
All
happy
right,
to help
Meenal.
you guys.
Thank you so much for joining us and spending your weekend with us. Today's topic for all our lovely AccuCheck Wealthy members is quite interesting. I think many of you have requested this topic to your health coaches, and that's why we have taken this up and we are going to discuss in detail. Don't worry. हिंदी और इंग्लिश दोनों में आज का डिस्कशन होगा सो दैट आप लोगों को सारी इंफॉर्मेशन अपने लैंग्वेज में अपने हिसाब से समझ आए. आज का टॉपिक है बहुत समय से चलता आ रहा डायबिटीज और उसके इफेक्ट्स, साइड इफेक्ट्स बॉडी पे क्या होते हैं, उनको कैसे ओवरकम करना है, ये आज हमें मीनल जी सिखाएंगी. सो ओवर टू यू मीनल.
Yeah. So before I start this topic, I would like to know in chat कि भाई जो जो members यहाँ पे attend हुए हैं, उनको since how long they are suffering from this diabetes. So I want to know in the chat कि कितने लोगों को from how long they are suffering this diabetes. 4 years. 25 years. My goodness. 22 years. 18 years. 23, 8, 19, 26. Oh my God. So आज का टॉपिक बहुत ही इंटरेस्टिंग रहेगा क्योंकि आप ऑलरेडी इतने प्रोलॉन्ग टाइम से, काफी टाइम से ये डायबिटीज को झेल रहे हो. ठीक है. आई एम श्योर आफ्टर कमिंग टू द वेल्दी आप उसको अच्छे से मैनेज कर पा रहे हो, बट देर आर सर्टेन थिंग्स जो आप नहीं मैनेज कर पा रहे हैं, या कुछ चीजें ऐसी होती है जो आपको समझ नहीं आ रही है कि बॉडी के अंदर क्या चल रही है. सो ये डायबिटीज जितना वो पुरानी होती जाती है उतना उसके वो रिलेटिव्स को इनवाइट करते रहते हैं. जैसे ना वो नया, जैसे शादी हो जाती है एंड देन यू एंड अप टू, फिर बाकी सब लोगों को इनवाइट करते रहते हैं. तो ये डायबिटीज भी समवॉट सिमिलर वैसे ही है कि जितना वो पुराना होता जाएगा वो पुराने दादा नानी, फिर उनके को रिलेटिव्स को बुलाते जाते हैं. Whereas in diabetes में we call this as a sharing partner basis पे वो बुलाते रहते हैं. So today we'll see कि कितनों को डायबिटीज हैम्पर करती है, कौन से ऑर्गन्स के ऊपर वो हैम्पर करती है. ओके. सो आवर बॉडी में सबसे पहले जो डायबिटीज हैम्पर होती है वो है थ्रू आउट द बॉडी. हर एक ऑर्गन के ऊपर डायबिटीज अफेक्ट करती है. ठीक है. स्टार्टिंग फ्रॉम योर हेड टू टो, एंड इट इज लाइक जहां उसको थोड़ा सा स्पेस मिल गया वहां पे वो सेटल हो जाती है, एंड देन इट स्टार्ट्स क्रिएटिंग ए डिजीज एंड अफेक्टिंग दैट पर्टिकुलर ऑर्गन. ठीक है. बिकॉज अपने फुल बॉडी में वी नीड शुगर एंड एनर्जी. दैट शुगर एंड एनर्जी इज प्रोवाइडेड थ्रू आवर ब्लड सिस्टम, ब्लड सर्कुलेटरी सिस्टम से. जब ये ब्लड सर्कुलेटरी सिस्टम थ्रू आउट द बॉडी इट्स मूविंग, ठीक है, अलॉन्ग विद द शुगर दैट इज कैरिंग इन आवर बॉडी. नाउ दिस डिपोजिशन ऑफ द शुगर occurs at one particular time, one particular organ. वहां पे वो अफेक्ट हो जाती है, वो स्टिक हो जाती है, वो रहना शुरू कर दिया. ओके, लगता है अभी ओके चलो ये मेरा घर है क्योंकि यहाँ बहुत सारी स्पेस है, बहुत सारा इजी टू एक्सेसिबल मेरे को एनर्जी मिलती रहेगी. ठीक है. इन दैट बेसिस ही स्टार्ट्स अक्यूमुलेटिंग ओवर देयर, और वो ऑर्गन को डिफेक्ट कर, ऑर्गन को अफेक्ट करती रहेगी और उसको खाते रहेगा. ठीक है. सो व्हेन इट कम्स टू द ऑर्गन्स, so organs can be किडनी आपने सुना होगा, रेटिनोपैथी दैट इज आईज आपने सुना होगा, डायबिटिक फुट, जो कहीं पे भी कुछ लग जाए और फुट पे वो अल्सर्स वगैरह होना शुरू हो जाता है, सो दैट इज डायबिटिक फुट. सेरिब्रो सेरिब्रोवैस्कुलर डिजीज यानी जो ब्रेन के रिलेटेड या ब्रेन में भी जा सकती है, बिकॉज ब्रेन को भी तो एनर्जी लगती है, फ्यूल इज नीडेड. सो ओवर देयर. देन हार्ट को भी लगता है तो हार्ट, पेरिफेरल न्यूरोपैथी जो अपने नर्व्स होते हैं उनको. सो ओवरऑल द शुगर का डिसएडवांटेजेस जितना जितना वो प्रोलॉन्ग होते जाता है, इट अफेक्ट्स फ्रॉम हेड टू टोज. डिपेंड करता है कि आप उस शुगर को कितना मेंटेन करते हैं और कैसे उसको चैनलाइज करते हैं सो दैट इट डज नॉट गेट डिपॉजिटेड. So we'll go through in each and every organ. So diabetes is an unmanageable blood sugar in the lower, in the long run it can damage to the arteries. So diabetes can increase the triglycerides and LDL cholesterol, that is which is a bad cholesterol, and clog the arteries leading to heart attack. तो वो जब हार्ट के ऑर्गन्स के ऊपर, हार्ट का जो ऑर्गन है उसके ऊपर जब शुगर की लेवल्स बहुत ज्यादा बढ़ जाती है, एट द सेम टाइम जब फैट की लेवल बहुत ज्यादा डिपॉजिट हो जाती है, जो बैड फैट जिसको बोलते हैं, बिकॉज ऑफ दैट देयर इज अ मिसमैनेजमेंट कि वो ब्लड प्रेशर को और कोलेस्ट्रॉल लेवल्स को बढ़ा देता है. बिकॉज जो नॉर्मल सर्कुलेटरी सिस्टम जो काम करती है हार्ट को लेके, जो पंपिंग इन एंड आउट होता है, उसमें दे स्टार्टेड क्रिएटिंग ऑब्स्टिकल. फॉर एग्जाम्पल इफ आई गिव यू, अपना जो नॉर्मल सिंक रहता है उसमें अगर कुछ ऑब्स्टिकल अटक जाता है, व्हेन इट गेट्स क्लॉग, तो क्या होता है, वो पानी आर पार नहीं हो जाता है. सेम इन आवर सिस्टम ऑल्सो, व्हेन देयर इज अ क्लॉग इन द ब्लड वेसल्स जो ऊपर, because of that the circulatory system gets affected and that leads to increase in your blood pressure. And also वो ज्यादा से ज्यादा फैट वहां पे जमा हो जाता है, and because of that the cholesterol levels keeps on increasing. So उससे क्या होगा, your body sugar level is going to on the higher side. For that what you need to do, ठीक है, ये तो हो गया. What is the management step? So first is to manage your blood pressure and cholesterol levels. ये किससे होगा? By maintaining a weight check and indulge in regular workout. जितनी physical activity आप कर सकते हैं, जितना physically active रहेंगे, obviously it's going to work the best. And the third most important point is consume well balanced and a nutritional food, जहाँ पे you need to balance all these organs. Now coming to the strokes. ये strokes कब होता है और कहाँ होता है? The major strokes occurs in your brain. ठीक है? This occurs when there is a clot in your brain vessels. Exactly जो same heart में होता है, वो same stroke अपन it occurs on the brain. So deadly matters and the people with diabetes more suffer with the strokes. There are more chances कि जब when the person goes into a hypoglycemia, जो जहाँ पे sugar बहुत कम हो जाती है, at that point of time there is more chances of getting a stroke. So you need to maintain your sugar levels. Okay. Apart from diabetes, stroke can also occur because of the high blood pressure, heart disease, obesity, and smoking. Now, vision problem. So when there is a circulatory system, the excess of sugar that accumulates on the eyes, on the internal eye के sides पे, and because of that, there is an clog in the blood vessels. So जो अपने को vision, we can see the vision होता है आगे, we can see. तो वो vision नहीं हो जाता, एक पर्दे जैसा एक layer thin film आ जाती है, which is a sugar film, what we say. Now that sugar film can be of different types. So one can be because of the age की वजह से भी हो सकता है. The other is because of the diabetic retinopathy, what we say, and the normal is the cataracts, जो वो slowly and gradually this leads to a loss or blurred vision. So what is the remedy for that? It's a regular eye checkup done by an expert in the ophthalmologist is compulsory. Early detection can prevent serious damage, and the best is to control your blood sugar levels. Coming to the foot ulcers. Now, in this foot ulcers can damage nerves and the blood circulation in the prohibited. Thus, it can lead to a foot problems. Now, just ये generally देखा है कि when you go for a walk, कुछ पत्थर लग गया या shoes में कुछ पत्थर था, that got थोड़ा सा hurt हो गया, and that the wound जो hurt हुआ है, it takes long time for the diabetic people to heal. और वो हील होने को बहुत ज्यादा टाइम लगता है, इसकी वजह से the chances of getting ulcers over that particular area, because it is more open exposure of that particular area. So for that reason, the foot ulcers are most common. Now, when it comes to cleanliness और उसको maintain करने के लिए, when we come from the bath, what we do, we generally wash our hands, then we wash, we wet, we take a towel and we make sure we pat it dry कर लेते हैं जितनों में we need to wear the clothes, but we don't knee down and we clean our foot. So because of that, the foot is almost moist and there are more chances of getting fungus and infection over on that particular area. So what is the remedy? After you take a shower, you need to bend down, you need to tap your shoes, tap your feet and make it dry. Then you need to wear a comfortable, well-fitting shoes, because the reason for that is during the during the walking or excessive exercise के वक्त, the people becomes that area so numbness that you don't realize whether you have wore the chappals or not. This specifically occurs during the exercise period or on even a normal walking area where they don't realize that they are wearing a chappal or not. So easy test is while you are wearing a chappal, you should try it out कि वो चप्पल निकल रहा है कि नहीं निकल रहा है. अगर वो निकल रहा है, that means the area of that senses you are losing it. So best is to wear a comfortable shoes. Okay, so that if even if it's निकल मतलब there are less chances कि वो निकल जाए. And before wearing it you should always clean it. मतलब वो shoes को उल्टा कर लो, उसमें से dust वगैरह निकाल दो. Keep your hand and napkin so that you clean it in case if there is a minor कुछ रेती वगैरह रह जाता है in, and then clean it and then you can wear your shoes. So that's the one remedy that you can try it every time whenever you wear the shoes. The other thing is check for the feet rashes, sores or blisters. कुछ भी लग जाता है immediately you need to check or you need to visit to the doctor and get it treatment done. Don't keep the wound open or undiagnosed for the long time. Make sure every night whenever you go to a bed, before that you need to check your feet regularly, clean it, apply a lotion or as per what doctors have suggested you can do that, and then as a daily regime of your feet is must. Then comes the diabetic neuropathy. Now in this neuropathy is the nerves get less of sensation. So it can be any nerves, either it can be a nerves of your legs, of your foot. It can also be the nerves of your hands. So what is the common symptoms? It's the numbness, tinglingness or burnings of hands and feet. Few people must have observed कि रात को सोते समय पैर बहुत जलते हैं. That's a common symptoms people complain. There is also a vision problem because of the neuropathy because the nerves get dried out. They don't have energy to give you or provide the particular organ के ऊपर वहाँ पे energy देने के लिए. There is a stabbing pain, stabbing in terms of एक सुई चुभना kind of pain होता है continuous. Because of that they are completely disturbed because of that. Chronic pain रहता है, continuous pain भी हो सकता है. They are quite sensitivity to touch. मतलब अगर थोड़ा सा भी touch कर लिया किसी ने तो उनको वो pain इतना aggravate कर देता है, इतना elevation रहता है उनको pain में कि ऐसा लगता है don't touch my feet. It's that kind of pain. At times you might also feel lot of diarrhea. There is loss of balance while walking or while sitting down or while a basic movements. There is a lot of weakness. For males, there is a erectile dysfunctioning, and for females, there is a vaginal dryness. That is a common symptoms that we see in the diabetic neuropathy. Then comes the gastrophoresis. ये बहुत common हो जाता है in today's scenario where we tend to eat lot of bakery items and lot of overeating in party शादी. अभी जैसे after the pandemic शादियां शुरू हुई है तो ऐसा लग रहा है कि every day is a शादी and a festival season. So for that reason we tend to overeat. इतना टाइम मिला नहीं ना, 2 साल का पूरा कोटा पूरा करना है. So because of that gastrophoresis में क्या होता है कि your abdomen is not able to digest the food properly, at the same time not able to pass the food that is digested to a small intestine. So the vagus nerve that is there, which you can see over here. So this vagus nerves जो it act as a sphincter muscle के जैसे काम करता है. जो खाना हो गया है उसको पचा के it sends to the small intestine for further absorption के लिए. तो वो जो स्पिंस्टर वो पैसेज जो गेट एंट्री वाला जो वॉचमैन रहता है ना वो बम्पर डाल देता है ड्यूरिंग द कार, ये हमारी गेट चेक करने के लिए वो चेकिंग के वक्त. सो दिस नर्व्स एक्ट एज अ गेट चेकर. So these nerves get damaged, and because of that, the food in the stomach is there for a long duration. अगर जब food, whenever the food is there for a long duration, what is going to happen? Obviously, the sugar levels are going to on the higher side, because it's going to keep on sensing, keep on giving the signals कि मेरे पास बहुत सारा food है, बहुत सारा sugar है. So the sugar is on the higher side. At the same time, the best solution क्या? Okay, we'll come to the symptoms. इसके symptoms क्या आपको feel हो सकते हैं? So what can be the heartburn is one of the reason. खाना खाने के बाद बहुत जलन feel होना, you get a lot of acidic burps आना, nausea होना, vomiting आना, feeling of fullness, मतलब एक आपने लंच कर लिया उसके बाद रात को खाने की बिल्कुल इच्छा नहीं होती, बिकॉज ऐसा लगता है खाना पूरा पेट में ही है, अब तक वो कुछ भी प्रोसेस नहीं हुआ है. So will you feel a lot of fullness. You might skip to the next meals also, or sometimes you eat a heavy breakfast and then you skip your lunch. Then you immediately end up to dinner, and again in the dinner you overeat, and again the next meal or the next routine is disturbed because of that. So you don't get that feeling of fullness as always. Then bloating is there, loss of appetite, weight loss, and stomach spasms. खाना खाने के बाद बहुत cramps लगना, पेट दुखना. So that is a common thing that in gastroparesis में होता है. इसका simple solution है, एक साथ बहुत कुछ नहीं खाना है. Small meals should be consumed. भले आप एक रोटी खाओ, but एक रोटी should be digested. आपको if your target to eat for weight loss अगर हो रहा है, if you target to eat for 2 rotis or 3 rotis, so split that rotis in different meals. Allow the food to get digested, and once it is digested, it will give you sensation कि अभी मेरे को भूख लगी है. Then you give the small quantity to your stomach, and don't overfill your stomach. यहाँ भूख लगी है, जो भी है बस आने दो. Don't do that. The most common which we feel is the kidney diseases. Now in this kidney, the sugar level is directly or indirectly connect with your kidneys. जो भी medicines we are consuming, the kidneys and the livers have to detoxify, it has to synthesize, extra sugar has to move out from your body through urine or through waste of your stools. So kidney plays a very important role. If if the functioning of the kidney is damaged, because if the sugar gets accumulated on the kidneys, then obviously the functioning of that particular organ is getting damaged. So the best is whenever if you feel that the urination, the quantity of the water that you have consumed is lesser than the output of the urine, then you need to immediately check with the doctor. You need to regularly check with your blood parameters of your kidneys. That is your SGOT, PT, the creatinine levels, the those levels has to be checked along with your doctors. And based on that, you need to follow the diet, and you need to eat a diet according to your kidney reports. Now, coming to the mental health. Now, since वो नाम सुनते ही we get very irritated कि यार 25 साल से मेरे को डायबिटीज है, 24 years I'm suffering from diabetes, I'm like pissed off with the diabetes. This occurs when there is like prolonged diabetes और उसके symptoms and उसकी complications आपको बहुत परेशान करते हैं. If you are managing well, then it is not going to affect you. And the other major part when it starts affecting, the day when you come to know that you are detected with a diabetes. So it directly or indirectly, it affects your uh, emotional health, or we say a mental health. Okay. So for that people, those who are recently detected with the diabetes, the first reaction when we say to the patient, okay, you are detected with the diabetes, this is your sugar levels. So first is that, oh, now I won't be able to eat my favorite foods. Oh, now I won't be able to do this. Oh, now I'm not going to do this. I'm diabetic. I'm a patient. I'm this. My life is gone. My life is done. I'm like now old age. I'm this, I'm that, I'm this. So these are the instant reactions that we tend to feel out. But in today's scenario, with the help of a medical science, with the help of the new technologies, with the help of a good food eating habits, with the help of a good researchers, we can deal with this. Once you give a positive note to your to your mental state that yes, it's okay if I got a diabetes, I'm going to manage this diabetes at a very good stage. Okay, I'm not going make sure that I am not going to you know affect my long term disease into a chronic conditions. I'm going to manage my anxiety. I'm going to manage my stress. I'm not going to get depressed. I'm going to live a normal life. Yes, with the precautions that that I need to be aware. So this is an alarming sign that my body is giving to me. I need to understand my body and work on that. So if you give this kind of positive notes to your body, to your mind, then obviously diabetes management is too easy. Okay. Even it comes to a financial planning also. Yes, if you do well in advance, then it is less to get a stress and anxiety regarding your financial plans. Now, diabetes is also related to your tooth decay. This goes way the key बहुत जल्दी ध्यान में नहीं आता है कि मुझे शुगर की वजह से my gums are getting loosen up, my teeth are getting cavities in that, my cleanliness is not properly. So this is where your blood vessels, the small blood vessels, get damaged, specifically on the gums area. So you get a bleeding gum and increase the risk of tooth infections also. So if you manage your diabetes well, then this periodontal diseases, that is a diabetic tooth decay, can be reduced. So you need to visit to a dental care doctor every 6 months. How to prevent long-term complications of diabetes? We all know, I mean, those who are new, we can start with that. So first is eat healthy. Now, eat healthy, we all know, ghas poos khana, ye, wo, but you can make it interesting by adding good amount of nutritious meals, a balanced diet, a colorful diet, a rainbow food kind of. So eat a lot of vegetables and fruits. Reduce or eliminate sugar foods and drinks. Watch or reduce carbs. So whenever any Tetra packs or any packaged foods you are consuming, make sure that you check the labels, read the labels, and then you have that particular product. Watch the portion size. Now, portion size is very important role because कितना खाने से कितनी sugar बढ़ेगी, that is very important. If you eat obviously one at a time, if you eat 10 rotis, obviously the sugar is going to spike. But if you split the 10 rotis into two different, I mean, into days, may 6 times, then obviously the sugar is not going to spike. This is just an example. You don't have to eat rotis. Okay, so this is a portion size example. Eat regular meals, don't skip your meals. So that is also one of the thing. If you eat less quantity, the next meal won't be get delayed or next meal will be consumed easily. And lose 10 to 20 pounds or like 10 kgs if you are overweight. So check your BMI, check your weight, check your height and weight ratio, and make sure that you are fit and fine. So the second steps plays a very important role. Be active. So exercise, the minimum requirement is 5 days a week. So that's 150 steps a week. The other is be active 30 minutes a day. So this is a minimum requirement that you can do. Even at any old age, even a 90-year people can do a 30 minutes of walk and has to be done. The third is monitor. So you need to regularly check your HbA1c. You need to check your blood pressure, cholesterol, eyes, feet, and your teeth. Check your medications on time. I mean, take your medications on your time, insulin pills or whatever doctor has suggested, and it should go in a right doses. So if the person is consuming insulin, make sure that there is a right dose of the insulin in compared to the carbs that they are consuming. Other is to recognize your high and blood sugars. Always understand that you cause them and learn to treat and prevent them. So your body always gives you a little bit of tips and a clues. So you need to read your body. You need to understand your body. Your body always gives you signal. So you need to understand your signals कि okay, ये होने वाला है या ये होने वाला है. So if you understand, then it is easy for you to solve that problem. Or even if you are not able to solve, you can have a word with a doctor or with your health coaches so that they can guide you and they can solve your problem before it gets worse. We have a कहावत सुना है ना कि a stitch in time saves nine. So वो वैसा ही सिस्टम यहाँ पे भी फॉलो होता है. Now comes your reduced risk. The best is to quit smoking. Do your regular health examinations and see your doctor regularly for checkups and tests. Cope well and make sure that you are surrounded in a good environment. If not, then create a good environment. So lifestyle changes is the must, and dietary changes along with the exercise is the key to balance your good diabetes levels. Now, these are the long-term applications, what we saw, long-term complications, what all things happens. Now, coming to a short-term effects, may generally we see there is a ketoacidosis. Now, this ketoacidosis में क्या होता है कि the sugar is the main concern for the body to get the energy. But in ketoacidosis, fat acts as a major source of energy in your body. So because of that, the body is not able to respond to the energy that the fat is providing. This occurs, one is in either a hyperglycemia stage or in a hypoglycemia stage, where the person is consuming extra fat or the person is consuming extra low sugars. So in this situation, because body continuously needs the sugar, the energy, so उसको कहीं से तो you need to extract out, कहीं से तो उसको चाहिए. So either in both the situation, the body has to work. It can also leads to, one of the reason can also be is a recurrent or a persistent infection, that is a tuberculosis or something that kind of. So that is also a short-term effect of ketoacidosis. I hope I have clear all the concepts. It's time for the quiz. So the question is, which one of the following is not a long-term complications of diabetes? Ketoacidosis, diabetic neuropathy, mental health issues, and tooth decay. लॉन्ग टर्म कॉम्प्लिकेशंस में क्या नहीं आता है? कीटोएसिडोसिस, डायबिटिक न्यूरोपैथी, mental health issues, tooth decay. You're done with the poll? Okay. Wow, great. 74 people have told the right answer. That is ketoacidosis. Tooth decay is one of the reason for long term. Mental health issues are also a long term complications, and diabetic neuropathy is also a long term complications. The true answer is ketoacidosis. In this, the stage of people is either a pre and the post. That is a hypoglycemia and the hyperglycemia stage where the people get ketoacidosis. And it's a short term. So we have introduced a new product. So जिसने भी नहीं किया है, have a word with the health coach. So now we'll start with the question answer sessions. So yeah, I've got one question. It says, I have foot calluses and
Yeah.
burning sensation under small area of left foot.
Yes. So, hi, Minal.
Hello.
Thank you so much. I think it was quite informative, and our Hindi users are also quite happy with using of Hindi language a little bit more. So, thank you so much for that. Thank you so much to all our AccuCheck Wealthy members. They were very proactive, and they have shared number of years they were diabetic and a lot of questions which you asked on. Also, Mr. Rao, we absolutely love your response of comparing married life to diabetes. Thank you for that. We have Ashok ji. Hello, Ashok ji. How are you? He has asked a question to you, Meenal, related to foot calluses and burning sensation under left foot. So, if you can guide on that.
So it has to check with the doctor only. So you visit the doctor and first diagnosis, and he'll suggest you some ointments, and then you need to apply that.
Correct. Okay. Anything more to suggest? Maybe a home kind of a technique which can at least ease out the pain or the problem which they are
No, for
facing.
the foot ulcers, best is to visit a doctor, and there is no home remedy until unless your sugar levels are in control.
Correct. So, primary reason, Ashok ji, sugar needs to be controlled, and we need to ensure that everything what is related to your blood sugars is discussed with your coaches. Yeah, all right. We have one more question. Let me just discuss this. Mr. Anand Krishnan Iyer. Hello, sir. Good evening. Thank you so much for joining today's session. We are glad to host you today and looking forward to your participation in the AccuCheck Wealthy program. He has a question, Meenal ji. He's saying, I'm 57-year-old male, 100% vegetarian. Kindly give me options. What snacks can I eat?
Okay. So the normal snacks items, what you can eat is, again, you need to have a word with your health coaches. What has she planned for you? That's one thing. Second thing is you need to also monitor your sugar levels. If they are in a good range, then you can have a fruit as one of the option. Smoothies is another option using nuts and chia seeds. The third option is roasted makhanas. The fourth option is roasted chana. Even the sprouts, the chana is a buna chana wala, the chana that you get with the brown skin. The other option is you get a sprouted. You can have a bale prepared out of it. The other option is you can have anything which is using oats chila or oats smoothies or oats along with your granular bars ki jaise you can prepare it without adding any preservatives and sugars and everything. So you can, as along with the nuts, mix it and you can just have with that. So these are the few options that you can try it out in the evening or at the snack times.
Great, awesome. I think that's a good start. So, Mr. Iyer, that is few options, but to give you a customized approach, what is your height, what is your weight, what are your requirements as per your blood sugar levels. We will customize as a part of this program. To know more about how the program goes, I think you need to connect with your health coach and she will guide you better. All right. So we have few more questions. Let's check on them. Mr. Chakravarti, good evening. Thank you for being super active in today's session. So, Meenal ji, Chakravarti ji wants to ask, what will be the status of blood glucose level in the blood if the eaten food is completely undigested due to some reason? Will blood sugar increase or decrease?
So it depends upon body to body mechanism. So for some people, if the food is there in the blood, I mean, if it's in there in the stomach, then genuinely it increases. But if there's a prolonged duration, like for 6 hours, and the person is not consuming the next meal, so if there is a drop down in that thing, then the sugar might drop down also. So it is depend upon the individual's body mechanism, how it's functioning. But once if the sugar, I mean, once if the food is there for at least 3 hours and plus, the sugar is on the higher side.
Great. All right. Thank you so much, Meenal, for some guidance. So, hello, Rauji. Good evening. Thank you so much for uh, being an active participant today. So, Mr. Rao wants to know, Meenal, effect of skipping breakfast on blood sugar levels.
So yeah, so breakfast is the most important meal of your day. It's like you're breaking the fast. So your dinner, if you had at 7 or 8, and then next day the body has worked a lot in the night. Body ने बहुत सारा काम किया है, cleansing of all the waste, removing out of the waste from your cells, from your body, from every corner of your organ. So body also needs energy. So if the energy is not a healthy option, or if you don't give the energy to your body, again, there is a more chances of getting into a hypoglycemia stage. So for that reason, breakfast skipping is not a good idea. Though you can reduce the quantity, but you need to have a breakfast.
Correct. Thank you so much, Meenal, for that. We have, Mr. Singh. Good evening, Mr. Singh. Thank you so much for joining today's session. He is saying he is a 40-year-old staying in Bangalore and is diabetic for last 3 to 5 years. Is it possible to control my diabetes at a level where my medications will be completely reduced or reversible?
Yes, it is possible. For that, you need to have a customized diet plan. You need to be active. Your exercise regime has to be set by the health coaches and the doctors also. So for that, you need to have a word with the your health coaches. So she'll the best person to guide you.
Correct. Thank you so much. Just to add to this, that is the reason AccuCheck Wealthy is here. That is the reason we guide you, we help you. Every person, let me tell you, being a part of the program and managing this program as a program manager, it's been a pleasure to host 1,25,000 users for last 2 years and at a consistency level of more than 97% of result achievement, wherein we have seen every person who has enrolled in our program with a drop of body weight, with a control of inches, with a control over their blood sugar levels and HbA1c. So do not wait for your customized diet plan. If you want to know more, speak to your health coaches today. All right, we have few more questions. So, Mr. Chakravarti is asking, diabetic patients need to use fit sports shoes or uh, larger size sport shoes. Will that affect our feet?
So a perfect fit size is best by using socks to wear before your shoes.
Great.
And
So
larger
sports
size
shoes
does
is
not
a good
affect, I
option.
mean, larger size is little risky of getting fallen down. So
Correct.
the best is to.
Absolutely. Thank you, Meenal, for that. I think sport shoes are really good. In the market, you get doctor curated shoes also. for some brands. You can also go for that. Hi, Joes. Good evening. Happy to have you back. What is the accuracy of AccuCheck measurement compared to normal lab test from blood plasma? Meenal.
Okay. So AccuCheck में आपका only the one portion of your blood is being checked. Whereas in the lab, a whole blood is extracted and that is done under a supervised 2-3 series of tests. So lab test and AccuCheck may you get a difference of around say 14 to 15% difference is there. So like average we say 10 to 11% we say. So 10% difference is there in the normal because in the lab we take a whole blood, that is your CBC, RBC, everything is being taken. Whereas in AccuCheck only one RBC is taken. So that is the difference.
Correct. Great. Thank you so much for that clinical validation.
Yeah.
We have a link shared for the diabetic program. Do click on the link below, and so that me and my team can assist you better. Happy to help you, happy to inform you. We are now a family of 1,25,000 users with a patient retention and with an NPS of 5 excellent rating for more than 97% of our patients. Um, we are happy to help you more as a part of this program. To know more about the plans in detail, please speak to your health coaches. It was great connecting with you, Meenal, today. Thank you so
Same.
much for giving us this informative session. If you would like to maybe share 2 3 parting advices for our users today.
So the first is always check your blood sugar levels on a regular basis. Exercise, go active is the key. Balanced diet is again one of the most important. Go colorful, go rainbow. So more you eat varieties of fruits and vegetables, the variety of good health is casted. So that's the key.
Great. For me, every user is important. And don't worry, Shrikantji, I will ensure that even if we are late for the session, I address your question. So, Meenal, Shrikantji is asking us, hello, I'm taking dinner at 11 p.m. Is it a wrong time? What is the ideal time or a perfect time to have my dinner?
Okay. So it depends upon the start of the day and the work activity that you are performing. So the first question would be, what is the reason for you to take dinner so long? I mean, so late. That's my first question. So because of the work is there, then obviously you can plan out in such a way, or you can carry your tiffin in such a way that you can have your dinner at 8. So 8, 8:30 or 7:30 to 8 is the last time to have the dinner. That's a perfect time. So if you could manage the dinner at that point of time, it's good. The reason for that is, so if you eat your dinner early, your body gets, still you are in an active zone. You do some kind of physical activity, or you're roaming here and there, or you do some home assignments, homeworks, or something that kind of. So your body is in a process of digesting the food so that it does not spikes your sugar levels. If you take your dinner late, the body does not get time to digest your food, and you immediately go for a bed, go to a sleep. So the whole exercise, whatever the energy is needed for the process of digestion, it's 2x more. So that is why you should, when you're awake at that point of time, you should have your dinner. So like 7:38 is the last meal that you need to consume.
Great. So, Shrikantji, don't worry. I have arranged a call back from your health coach after this. She will guide you on dinner में क्या क्या होना चाहिए, कैसे डिनर लेना चाहिए, और कौन कौन सी चीजें हैं which will help you manage your blood sugars, have a healthy, wholesome meal, and also, you do not sleep empty stomach or have your dinners late. So don't worry, we are here for you. Please speak to your health coach after this and she will definitely guide you. We have few more questions. Let's quickly take them up, Meenal ji. So our user Ragini Singh ji is asking us, for the last 1 decade, I'm a patient of type 2 diabetes, getting treatment and taking medications regularly. She has mentioned her medication details. Maybe you can read through. In the
Okay.
evening, I find upset and level drops down. When I take some food, I get normal. Why? Am I having more medications?
So for that, for this, we need to check your personal, your dietary pattern, what all foods you are consuming. So your food, your sugar level drop down. It's like you're going to a stage of a hypoglycemia. So for that reason, you need to visit a doctor, one, and your health coach would guide you better to understand how to split up your meals and how to eat at frequent intervals.
Correct. Okay, great. So, Ragini ji, if you are already connected to a plan and a health coach, please speak to her on this in detail. She will help you out. If not, this is the right time to check with your health coach and go for it. Hello, Mr. Rao. Good evening. Thank you so much for joining today's session. Mr. Rao wants to know, Meenal, instead of breakfast, like a proper fresh breakfast, can I have muesli, sprouts, or fruits?
Yes, you can have that. But
Great.
again, you
If
need to
you
have a check with your health coaches, check with your sugar levels. If yes, then fruits, yes. Sprouts is good to go. But again, make sure that there is no bloatingness or indigestion issues with that. So check with your health coach and she'll be able to guide you with that.
Great. Okay. Sugar level fasting and post meal is normal, is what Ragini ji is saying. So, Ragini ji, don't worry. If you want to connect maybe separately to your health coach and discuss this, we will be happy to help. If your health coach needs any expert guidance, we will connect with her and we will guide specific to your case for her assistance. All right, so that has been a very conversational session. Thank you so much, Meenal, for being a
Thank you,
part
Rutuja.
of the AccuCheck Wealthy program today. And I'm sure we'll have you more often and discuss on a lot of such topics. Thank you so much for today. Thank you to all our lovely AccuCheck Wealthy family. We are coming next week with a new speaker, a lot of new information, and a lot of guidance and coaching to all of you. Meanwhile, take care of your health. We are absolutely there for you, available for you, but do not forget living those small moments on your weekends. If you want to know more about Holi coming up, please speak to your health coaches. We are going to share some special Holi recipes for you, which you can enjoy and not spike on your blood sugar levels. To know more, talk to your health coach and please come on a plan so that we can personally customize your journey for you. Meanwhile, take care of your health, take care
You.
of ensuring that you are happy, healthy, and have a great weekend. Anything else from you, Meenal?
Thank you for being so wonderful participants.
Great. Thank you so much, Meenal. Thank you
Thank
so
you.
much to my AccuCheck Wealthy family. See you all next weekend. Till then, take care. Bye
Thank you.
bye.